Thank you for being here. Can you tell our viewers what is microdermabrasion?
First of all, to get the understanding where microdermabrasion originated from, it started back in 1985. It was discovered in Italy. It was developed actually in Italy and moved throughout Europe. In the 90s, it became popular in the United States of America. Microdermabrasion is used for removing fine lines, hyperpigmentation, acne scars, age spots. And it's good for, just rejuvenating. It's a form of rejuvenation which rejuvenates the skin.
Okay, so can you tell us who is a perfect candidate and who isn't a perfect candidate for microdermabrasion?
A perfect candidate for microdermabrasion is someone with age spots, acne, that you've had acne in your younger age, and you do have a bad form of acne, and you have acne scars, as well as very fine lines. Candidates that's not good for microdermabrasion is someone, for instance, that has rosacea.
What is rosacea?
Rosacea is, the skin is very sensitive, very red. If you notice, some people, the cheeks are extremely red, or in the entire face, that's rosacea. And that should not be treated by anybody to do microdermabrasion. Or somebody that has diabetes, because what you're doing with microdermabrasion, you're actually sandblasting the skin. And it's a deeper form of exfoliation that you're doing. So it's not recommended for people that have
They're diabetic
or warts, or deep wounds of any kind, so forth. That's not the candidate for microdermabrasion.
Now, with this sandblasting technique, how deep do you go in the skin? Is there different levels, or?
Yes. With microdermabrasion, the skin, the top layer of the epidermis has 20 layers. That's the top, and you're removing the first 2 layers, which needs to be exfoliated. That's going to give you a really healthy and healthy glow.
Okay, now, I'm wondering, is that good for all types of skin, meaning African Americans? Because sometimes African Americans, we have a tendency to have scar tissue.
Exactly.
Now, is that good for any kind of skin?
That's good for any skin type, but you have to have the right training. At first, let me go back and say this. At first, when microdermabrasion was introduced into the United States, only doctors like plastic surgeons and dermatologists, they were the only ones that were able to do it. Years later, it became popular where estheticians could now perform that service. It's best to have a esthetician, if you're going through an esthetician, that's really trained